No matter how old a person becomes, there is always a desire in the heart to remain strong, to walk with confidence, and to feel that the legs will support the body. However, as age increases, many people begin to realize that tasks which were once easy now feel difficult. Getting breathless while climbing stairs, pain in the legs after standing for a short time, sudden muscle cramps at night, and a feeling of weakness when getting out of bed in the morning. These are symptoms that most people consider a normal part of aging and choose to ignore. But the real question is, are these problems truly inevitable, or is there another hidden reason behind them? Many elderly people often say, "This is just old age. Strength naturally fades." But the reality is that as we age, the body's needs also change. The things the body used to produce on its own in younger years gradually begin to decline. In particular, certain nutrients and vitamins become deficient over time. This deficiency slowly weakens the muscles, slows down the nerves, and affects the natural strength of the legs. The problem is not aging itself. The real problem is that the body is no longer receiving the support it needs the most at this stage of life. Nighttime leg cramps are especially common. People are in deep sleep when a sudden sharp pain wakes them up. The muscle tightens, movement becomes difficult, and for a few moments it feels as if the leg has completely stopped working. Some people immediately massage the area with oil, others use warm water, while some simply wait for the pain to pass. But the real question remains, why does this pain keep happening? Is it just fatigue, or is there an internal deficiency behind it? Similarly, during the day, heaviness in the legs while walking, pain in the calves, or weakness below the knees is very common. Many elderly individuals begin to limit going outside, stop walking altogether, and gradually reduce physical movement. As a result, the muscles weaken even further, balance deteriorates, and the risk of falling increases. Interestingly, in many cases, this does not happen because the body is worn out, but because it is not receiving proper nutritional support. There is a particular vitamin that most people tend to overlook, even though it plays a crucial role in muscle function, nerve signals, and overall leg strength. Its deficiency develops slowly, which is why most people do not realize where the problem actually lies. Pain is blamed on the joints, weakness on old age, and cramps on dehydration, while the real cause lies elsewhere. This vitamin is responsible for signaling muscles when to contract and when to relax. When it is present in adequate amounts, muscles remain flexible, strong, and balanced. But as soon as its deficiency begins, muscles tighten without warning. Nerve signals weaken, and the result appears in the form of cramps, pain, and weakness. The legs are affected first because they carry the body's weight throughout the day. Some people believe that they eat well, so deficiency should not be possible. However, the truth is that as we age, the body's ability to absorb nutrients also declines. The same diet that was sufficient at the age of 30 or 40 may become inadequate at 60 or 70. In addition, certain medications, especially those for blood pressure, diabetes, or digestive issues, can reduce specific vitamins in the body. This is why many elderly individuals visit doctors, undergo tests, and are told that all reports are normal, yet their weakness and pain persist. Mild deficiencies of this vitamin are often overlooked in routine tests, even though they are quietly making daily life more difficult. Interestingly, when this vitamin deficiency is corrected, many people begin to notice improvement within a few weeks. Strength slowly returns to the legs, walking confidence improves, nighttime cramps decrease, and mornings no longer feel as heavy. People are often surprised and say, "We thought this was just because of aging." This is not magic, nor is it a one-day miracle. It is simply about giving the body what it had been silently lacking. Just as dry land slowly turns green when it receives water, the body gradually regains strength when it receives proper nutrition. However, one thing is very important to understand. Every body is different. Some people have a severe deficiency, others only a mild one. That is why excessive use of supplements without understanding or medical guidance is not appropriate. The real goal is to identify where the problem began and correct it in a balanced and safe manner. Many elderly people also say, "We have worked hard all our lives. Now we deserve rest." Rest is indeed a right, but complete inactivity is not. When the body receives the right vitamins, along with gentle movement, it has an incredible ability to heal itself, no matter the age. Many people ask whether leg strength can really improve at the age of 60 or 70. The answer is, to a great extent, yes. It may not return to the strength of a 20, but it can become strong enough to walk without fear, stand comfortably during prayer, and perform daily tasks independently. And that is the real success. It is also important to understand that leg weakness is not just a physical issue. It also limits a person mentally. When someone constantly fears that their legs may give out, they can find themselves indoors. Social activities decrease, mood is affected, and the joy of life slowly fades. But as soon as even a little strength returns, confidence begins to grow again. That is why calling this vitamin merely a solution for cramps would be incomplete. It is deeply connected to overall leg health, the nervous system, and confidence in movement. When this system improves, Its positive effects extend to both the body and the mind. In the next part, we will explore in more detail how this vitamin works in the body, who is more likely to develop its deficiency, and which daily habits can worsen the problem. We will also discuss how to support the body naturally, gradually, and safely, so that no matter the age, the legs continue to support life.